Hey, I'm Sarah Carnes, and we are on the road today. We're taking you on a tour. We're here at NEOSkin Med Spa in Hudson with Dr. Bedrick and her team. We have a new body clinic. It's absolutely gorgeous here. So much to offer. Thank you so much for having us out.
Oh, we're so excited to reveal this to Northeast Ohio.
It is amazing. There's so much to learn. So first of all, tell us about the new body clinic and everything you have to offer here.
Sure. So at NeoSkin, we really started, our bread and butter was with skincare, Botox, fillers, laser. And over the last couple of years, everybody has been asking about, hey, how does that CoolSculpting work? How does Sculpt work? And what can we do? You know, we're all getting a little older. So what can we do that's non-surgical? So about two and a half years ago, we first started looking at CoolSculpt, and CoolSculpt is a non-invasive way to freeze fat, and we can really do it in a way that we contour and sculpt the body. So if we have to debulk a little bit, we'll go ahead and do that via CoolSculpting. Sometimes it's a matter of really we don't have to debulk, but we just want to tone. So we have another machine called Sculpt Neo, which is the new machine that it actually builds muscle and burns a little bit of fat at the same treatment. So we're happy to be one of the first in the areas to have that here. And then a lot of people will ask us like, well, how do I like tighten the skin here in the jowls? So we do have a machine called Axillus Ultra, and it's radio frequency and ultrasound, really newer technology that really heats the existing collagen to tighten the skin. And then we also have a machine that does pelvic floor exercises. It's called Cella. It's for if you ever try to do those Kegel exercises, as especially women, as they have pregnancies, they might have a little bit of urinary incontinence when they, you know, cough or sneeze or dance. So this machine in a 20 under 30-minute treatment, it will help do like 12,000 contractions for that.
It's so good to know there's so many options that are non-surgical, that are easy to get to and apply. So what if someone just doesn't know? They kind of, hear all these different things. Maybe they have questions. Is it best just to come in for a consultation? How does that work?
Yeah, that's a great question. We get that very often. So we do have a body clinic consult, and we have a dedicated consult room now, which is great. And basically, you come in, you tell us your concerns, and then we can design a plan to treat those concerns, to address the concerns. A lot of times people will come in and they think they want one, they really heard their friend had the skin tightening, but then we look at it and we really need to customize for you, for the individual person. And what's really nice is the services do, a lot of times the plan is a little bit of CoolSculpting and a little bit of muscle building, so at that consult, it's a completely complimentary consult. Everything's written down, pictures are taken, really explain everything in depth. So we're always just here to teach and learn, and never any commitment with that.
So we're talking about the body clinic right now, and again, brand new. It's so gorgeous. We're going to take a tour in just a minute here and talk to some other staff members in more detail. But tell us about the other services that you offer as well here.
So we also have, if you ever just want to come in for skin and you're like, I don't know, I've got a little bit of wrinkles, or where do I start? So you can also come in for we call it aesthetic consult. And that's where you'll be with a nurse, aesthetic nurse injector, aesthetic nurse practitioner, or myself, a physician. And we basically explain to you where we're starting, mm-hmm. what services treat what areas. Like sometimes people say like, hey, I don't like those 11s between my eyes, then that would be a muscle relaxer, which is Botox. Sometimes they're like, the dark circles under here, is that for Botox? That's more of a filler. But we start that by every new consult for the aesthetics, they come in and their face will get scanned and our Visia facial analyzer. And we actually will prove to you like what we're recommending is based in science. And so it's really informative.
It's cool. You even said people like will do it a year later and it'll show what improvements they have. That is so
Yeah.
neat.
So it will take you at your age, in your skin type, and it will compare you to the database, and it will give you your skin age versus your true age versus your skin
Right.
age. And then as you do the services, you can see great improvement, which is so exciting.
Yeah, that is. Okay, so I'm excited to take a tour and talk to some of the other staff members about everything in this new body clinic. So let's take a look around.
All right. Well, thank you.
All right, first stop on our tour today. Again, here at NEOSkin, I'm here with Kristen. We're talking CoolSculpting here. And I want to say, I talked a little bit to Dr. Bedrick about it. It's really cool, but I want to dive a little bit deeper and let our viewers know, well, who is CoolSculpting for?
Okay, so CoolSculpting is great for a client who's about 20 to 30 pounds within their ideal weight. It's not a weight loss solution. It's really for that pinchable fat that's really stubborn and really difficult to get rid of. So that's really the perfect client.
So can you tell me, how long does it take? Is it painful?
So it is, it's not really painful. I always say it's sort of like a bruise and a sunburn. That's kind of how it feels after your treatment.
Okay.
Depending on how much tissue is there, there's different applicators that I can use for a treatment. And I come up with a treatment plan that way. For the abdomen, it can be anywhere from two applicators to maybe even 8.
And how long does it take? Is this something you can come in on your lunch break and get done?
It can be. We actually have the CoolSculpting Elite, which is the latest and greatest in CoolSculpting technology. So we can at times quad sculpt, meaning we can have 4 applicators going on the abdomen or the flanks at the same time.
Okay, so when you say applicators, that's maybe one session. How many different times or how many months does it take? Is it different for everybody?
So one session can be anywhere from 2 applicators to maybe 20 applicators. So it all depends on what tissue that we are looking at, different body parts, and then whatever game plan we come up with.
And what kind of results can people expect and for how long?
So what we're doing is we're killing fat cells permanently. This is a 20 to 25% fat reduction to that area with each treatment. So I always like to say it's like we have 10 balloons. We're going to be popping about 2 to 2.5 of those balloons each time.
Wow. And how do you know if it's good for you, if you're a good fit for this?
So really, when you come in for your consultation, I'm going to be looking at your medical history, going over any of concerns that I might have. But really, I'm looking for that BMI that's within that 30. So that healthy weight, 20 to 30 pounds, you can be that range there.
Continuing on our tour today, we're with Kylie here. We're talking about Sculpt Neo, right?
Yes.
Okay, so tell me, what is this?
So the Sculpt Neo is, it's basically a workout to a muscle group. It is contracting the muscles using a high frequency electromagnetic contraction, basically MRI technology, to truly work out and contract those muscles. We are specifically placing it in areas where we're targeting. So we can treat the abdomen, for example, and it's the equivalent of 24,000 crunches in a 30-minute treatment.
Wow. Okay, so who is this for? What type of person would be great for this type of treatment?
Right. So you're going to get the most out of this treatment if you have, if you're within maybe 10 to 20 pounds of your goal weight, but you're really looking to increase strength. We do have the ability, though, to treat BMIs up to 35. It can penetrate through some of that subcutaneous fat and visceral fat as well. So it really could be for just about anybody.
So the goal would be to help build muscle?
To help build muscle. That's the main goal. The original device, the main goal, of course, was to build muscle, but now they have improved it. They have a brand new device, and it's the Sculpt Neo. We were one of the first in Ohio to receive it, and it's also eliminating about 30% of fat, as well as building the muscle, about 25% increase in muscle strength.
Okay, so walk me through someone coming to get the treatment.
Right.
How long does it take? How many sessions is maybe someone's typical goal?
Absolutely. Absolutely. So this is a 30-minute treatment. Every specific group that we're targeting is a 30-minute treatment. And it's something you would do once a week. Initially, it's going to be once a week for 4 weeks. And then after that, you would go into something like maintenance. that first 4 treatments is the equivalent of 12 to 16 weeks of high intensity interval training
Oh, wow.
in 4 30-minute treatments.
Wow. So how do people know like what areas would be the best target? Is that something that you help them decide?
Right, absolutely. So typically someone comes in with an area in mind that they're concerned with. We can treat the abdomen, we can treat the arms, we treat both the biceps and the triceps individually in one package. We also do treatments for the buttocks, the inner thighs, the outer thighs, the tops and the back of your legs, as well as your calves.
Is this something that someone would come in and have a consultation to know if they're a good candidate?
Absolutely. It's really quick consultation. We're just going to, discuss what their goals are, take a look at the area they're concerned with, and obviously show them the room in the machine.
Well, thank you so much,
Yeah,
Kylie.
absolutely.
Talking about a new service now, I'm here with Ashley. Okay, tell us about Quo, right?
Yeah.
Okay.
So Quo is a non-surgical treatment. It is an injectable and it's FDA approved for the buttock area for cellulite.
Okay, so you have cellulite, you
Yes.
want to get rid of it. What's the process kind of if someone would come in to see, am I a candidate for this? What does that look like?
Sure. So you would come into the office, we would do a complimentary consultation, sit you down and kind of do an assessment in that area just to make sure that you are a candidate. And it does treat anywhere from moderate to severe cellulite in that buttock area.
Okay, so tell us, how does this work?
Okay, so it's actually pretty incredible. So it's an injectable. So you would inject into the cellulite dimple that you're seeing on the appearance of looking at this area. And basically what the enzyme is doing that we're injecting is it's cutting the fibrous band that's pulling down and creating that dimple appearance that you see.
Is this something that is an in and out procedure? You could maybe come on your lunchtime. And how many does it take to fix your cellulite?
That's a good question. So so the consultation is very short and simple. We most of the time can go ahead and do treatment same day, just making, we have to make sure that you're a candidate at first. It takes about, I would say, there's a little bit of prep, about 15 to 20 minutes to actually do the treatment. And then it is 3 treatments, 21 days apart. So you would come back a couple days or 21 days after that first initial treatment each time.
And how long does it last?
So it's a permanent loss of that appearance that you see.
That is great.
Yeah.
So again, someone would know they're a good candidate. They come in, they make a consultation. Is there anything else they should know about the treatment?
Not really. It's fairly simple and easy.
Is it painful? Is there anything?
Oh yeah. So the actual procedure is not very painful at all. Afterwards, you do go home and there's pretty significant bruising, and bruising in the sense that we inject in the area and then the bruising actually spreads because what's happening underneath is you're redistributing the fat cells underneath. So as the enzyme is kind of eating that band, it's kind of pooling of blood that kind of just spreads out. So the appearance is much more scary than it actually is painful.
It's worth the reward.
Yes, for sure.
Well, thank you.
Of course.
All right, another new addition here at the Body Clinic is the IV Lounge. We're talking to Amy. Okay, so tell us about the lounge and what different IVs that you offer.
Okay, so in the IV Lounge, we all offer a multitude of things. You can come for something as little as a B12 shot or a vitamin D shot, which would just take a minute or two, and that's an actual injection right into your arm. Or you can come and you can get a bag full of fluid, and then you can choose depending on what your needs are, how you're feeling, or what you feel you're deficient in, and we can mix up a customized IV specialized just for you.
Okay, so something that pops into my head is I'm going to be traveling soon. I want to have a little immune booster. Do you have something like that?
We do. And a lot of it, sometimes we add some vitamin C, or there's other things we can add. And we even have something called glutathione here. It's an antioxidant, which can kind of clear out some toxins and just improve the immune system in the body overall to prepare for travel or anything.
Yeah. Tell us about some of the other IVs and what people maybe come in for. What are the popular ones?
So glutathione is a popular one. People know it in different areas. It does many different things. It's very good for the skin. It's an antioxidant, like I mentioned. and also great for the immune system and detoxify. So that's a common one that a lot of people ask for. After that, I would say a lot of people want mostly the fluid. They feel dehydrated. Maybe they want B vitamins, sometimes magnesium. Sometimes people are having maybe some PMS or migraines, and then we have, sometimes things we can add to it for those type of things. But mainly, I would say most people come in for really just the fluid and just getting rehydrated.
Yeah.
Not treating anything medically here. We're not in, emergency room or anything. It's just kind of giving you a little pep when you maybe didn't sleep well or had a weekend or something like that.
Yeah. So is everyone a candidate for this? Do you come in for a consultation first? How does that work?
Yeah, you don't really need a consultation first. You do need an appointment for it. You fill out a small health history when you get here. And there are a few things that might rule you out. If you have a higher blood pressure, that might rule you out, but we can have you sit and wait and see, some people get the white coat syndrome. So we'll see if it comes down. And a few maybe cardiac conditions, heart conditions that we might have to rule you out for. But for the most part, someone would know if they weren't a candidate.
Yeah. And it's really relaxing. You kind of just come in, take a seat in the nice lounge, you take care of them, and then just sit and relax, right?
Right. They sit in some nice chairs. There's a television. The chairs have massage and heat, and there's a nice window in there. So if we're having some gorgeous weather, you can.
Yeah. How long does it take? And does it vary for different
Yeah.
IVs?
No, it really doesn't vary per IV. It takes, for the whole appointment, you would come in, do your health history, do vital signs. It takes about an hour total. Or if you're just getting, like I said, one of those little shots, it's really in and out in 10 or 15 minutes maybe.
Awesome. I'm sure you can see the whole menu, all the different IVs that you offer on your website.
Yes, yes.
Thank you so much, Amy.
You're welcome.
Kristen is back with us. We're talking about X-Less. Okay, what is this?
So X-Less is really great for the lower face and neck, the décolleté, back of the hands, even around the eyes. This is something that's going to help rebuild the collagen and the elastin, really those building blocks of our skin. Kind of think of your sweater that gets stretched out as we age. What we're going to be doing is like throwing it back in the dryer and kind of rebuilding those fibers there. It's really a great treatment to get before your Botox and fillers. Really helps all those treatments last longer.
Okay, so walk me through this. Someone comes in, should they have a consultation first to know if they're a candidate?
It is one of those things, if they do have metal in the body, we do have to be aware of that. Dr. Bedrick always takes a look at their intake forms and we go from there. But yeah, really any age. So it's great for just rebuilding that collagen and the elastin, keeping us looking younger.
So it's going to tighten the skin. Yes. How long does it last?
Well, each body part takes a different amount of time. Really the lower face and neck, it can be like an hour and a half, but it is very relaxing. We use a lot of ultrasound gel. We're using radio frequency and ultrasound together, those modalities to create that tightening of the skin.
Okay, so it takes about an hour and a half or somewhere around there. How long do the results last?
So what we're doing, we're going to do those treatments once a week. There's 4 treatments. And then after that 4 package that we do, really like to bring the client back in about every 3 to 6 months and do like a touch up.
Oh, perfect. And you said this is something that a lot of people choose to do before Botox or fillers.
Yep.
All right, back with Dr. Bedrick here, talking about Emcella. Tell us about it.
So Emcella is a pelvic floor strengthening machine. So that's a lot of words just to say it does Kegel exercises for you. So the reason that often Kegel exercises are recommended, especially in women, are after childbirth. Usually there can be injuries that cause us to, when we cough or sneeze or dance, maybe have a little urinary incontinence. So this machine will do over 11,000 Kegel contractions in 28 minutes. And like I said, it helps for urinary incontinence. But also, as you build that muscle, it increases blood flow to the muscle because it's being built, which the side effect of this is increased sexual vitality. And people will obviously say, like, what do you mean? So it will increase lubrication. Some markets will market this as orgasm chair, things like that. It can be for men and for women. Men, it would obviously help a little bit more with erectile dysfunction. And just like as we build that muscle, the pelvic floor muscle will increase blood flow. So that's the side effects, but it is FDA approved for urinary incontinence.
So is anyone a candidate who maybe is struggling with that?
It definitely, now we do have to review history and make sure that, there's different kinds of, different reasons for urinary incontinence, but, a quick consultation could, we could make sure that you're a candidate. And it's usually twice a week for 3 weeks, so 6 treatments, and then you go on a maintenance.
Oh, that's what I was just going to ask, because I'm still floored. In 28 minutes, you do how many?
Over 11,000 Kegels. And even like for myself, obviously, I tried it and I noticed that I always thought I was just a light sleeper and I would just get up just because I'm waking up and I'd go to the bathroom. But when I use it, I don't have to get up and go to the bathroom at night. And so there was a little bit of form that I didn't even know, so it's very interesting.
And when you say maintenance after the first initial set, is that once a year or when needed?
It kind of depends. We have to see how you do. Usually maybe once a month, once every 3 months, but we kind of see what works for you.
Awesome. And what is this called again?
It's called Emcella.
Emcella. Awesome. Thank you so much.
You're welcome.
Well, I hope you enjoyed the tour of NEOSkin Med Spa right here in Hudson. Dr. Bedrick and her team, they're here to answer any questions you have. You can also go on their website. It's neoskincenter.com. And stay tuned right here on Facebook Live. Dr. Bedrick will join me to answer all your questions. Interview and the tour of the body clinic. Hey, it's Sarah here with Dr. Bedrick, live answering all your questions. That was so great, Dr. Bedrick. Thanks for joining us to answer questions. We already have a handful of them.
Oh, great. Thanks for having me, Sarah.
Okay, so the first question that I have here is from Nina, and this goes into you having the IV area for the different IVs. Are there any blood tests involved to find out if someone is deficient in something before getting an IV to get an accurate idea of what they're lacking or what they might need?
So in general, we have basic IVs that are depending on what you're coming in complaining of, but we do offer age management services, which age management is really trying to balance the hormones. I always say, like, if you're kind of been stuck with your regular practitioner and not getting to like maybe the bottom or the cause of a current condition, we'll go ahead and do a workup specifically looking at the hormones. A lot of times with that, we will find vitamin deficiencies that affect the hormones and the hormone balance, but that the blood work is not necessary to do just a general IV. We like to think of those as rehydration, immune boosters. I had one the other day because I had a migraine, those type of things. There's some things that we can do generally that are very, very safe, but specifically when we want to look for the deficiencies, we ask you to come in through our age management and do a complimentary consultation for that.
Great. Well, thank you. Okay, so we're going to go back a little bit. One of the first things we talked about was CoolSculpting.
Yes.
And Chelsea had the question, recovery time for CoolSculpting. What does that look like?
So I've had it myself. What drew me to CoolSculpting is I really did not want to do a surgery. I really didn't want to have drains and compression and all that type of thing. So the first thing I looked at with CoolSculpting, it's non-surgical. It's in the office. However, with that said, we are freezing fat, on the body from the outside in, and your skin is covered and protected. However, afterwards, when we start to warm up the skin, we do a 2-minute massage. And that massage is really beneficial. Like 70% of your results are in that massage. And that's really when the fat cell, when we manually massage it, will rupture, and then your body will start to clear that out. Afterwards, once the 2-minute massage is over, you're gonna expect to feel numbness, a little bit of, you can have pain at that area. And it, you know, it can last, it's just different for everybody. Sometimes it could last up to a week or two just in that area that was treated. And sometimes other people just say like, I went back to normal activity, I didn't feel anything. For me personally, is the first time I get one specific new area treated, that's probably, I'm going to have that little numbness for a week, maybe 10 days. But next time I get it treated, I just go about my business. There's no problem there. So it is, the benefit is it's non-surgical. I'm not going to say it's, you know, completely pain-free, but you don't have to go into surgery. Nobody has to drive you here, that type of thing.
Okay, next question is from Kayla, and she asked, how much is dermaplane?
So dermaplaning we do with our estheticians. A lot of times we do it as an add-on to a facial, but dermaplaning, for those who don't quite know, is really we remove all the vellus hair, which is the hair, that little peach fuzz. Okay, so if you kind of have that, that does not respond to laser hair removal. So you can just take a scalpel and the estheticians will get that all off. Then they proceed to do, you know, a facial, chemical peel, and the hair's not blocking it. And then you're nice and smooth. You know, it also does manual exfoliation. So you are getting a little facial with that. The price of that is $100, usually on an add-on to our service.
All right. So we just had a full tour of the body clinic. We learned a lot. What are some of your most popular services in the body clinic?
So I want to say all of them, but let me explain why I say that. So somebody comes in and they heard about, they're like, okay, I'm going to get that CoolSculpting. I've been thinking about it. I saw commercials for it. My friend got it. I'm going to do that. But really, when you come in, we have professional, very experienced nurses that are going to evaluate you totally. And it's just like, I'm a family doctor by training, and I'm always taking care of the whole person. And so when you come in, if you're say, oh, I'm just interested in this CoolSculpting, we're going to do a whole consult, and we're going to address like how each one of our services might help this area, that area. And it's all going to be written down. It's all going to be prices given, things like that. So you with your provider can, you know, decide where you want to start. You don't have to make a decision that day. We have people come back, you know, 6 months later, a month later, a year later, and they're like, okay, I'm ready for this. You know, I've talked it over with my family, and this is the way we're going to go. So CoolSculpt, you know, literally, you know, is really for the freezing of the fat. The M-Sculpt builds the muscle, and in turn, to power that muscle contraction, will decrease the fat. And with the new M-Sculpt Neo, that radio frequency, which is heat, will also tighten skin. Now, it's not FDA approved for that, but we are seeing that significantly as a side effect. And a lot of times the Excelus Ultra, the radio frequency and ultrasound, people come in and say like, I really don't like these jowls. And this is a nice procedure because it's relaxing. In 4 treatments, you're going to really see a difference in this area. Now, the Emcella, the one that does the Kegels, really just specifically for that, for the improving of the urinary incontinence, that when you cough, you sneeze, you might have a little dribble.
And Cassidy had a question, I believe it was on the X-List while we were going through that. How many treatments? I think you mentioned it there, but just one more time for her.
Yeah, so X-List is one that we have found that we really don't market it externally too much. We just like when people come in and they're getting their Botox or getting things done, they're like, what about this tightening like right here? And they're like, is it time for a facelift? No, it's not time for a facelift. Let's do Excelus. Excelus is like what Kristen was saying in the video about, you know, your collagen gets a little stretched out like an old sweater. And with the Excelus, with radio frequency and ultrasound, it will tighten that collagen for you. And then you won't see that gel. Usually what we recommend is a series of 4 treatments spaced every 7 days to 2 weeks apart. Then after that, you can just play it by ear. Usually, every 3 months, every 6 months, you can just come in for a little tune-up.
Great. Okay, so before we wrap things up, I want to know if there's any specials that the Bodies Clinic is running now that you want to share.
Yeah, so in the month of July, we are having 25% off all of our Body Clinic services, which I'm very happy to announce because I really want everybody to come in and see our new space. We do have specials that rotate every month. Next month, we have something really exciting. The Sculpt, it's an Sculpt Neo bus is coming. We had this last year at the national bus that has all, you can like try all the different procedures on this bus. And it's kind of fun. I think that's going to be August 17th, just for 2 quick hours, 1 to 3. But we will have a lot of special pricing that we will announce that day. So if people want to follow us on Facebook or go onto our website and sign up for our email, we'd be happy to share that with you in the future.
Great. And you're located in Hudson. Again, this is Dr. Bedrick. We're talking NEOSkin. You could rewind, play this video back, get all the details. And of course, you could call them. You guys are always great to chat and come in for a consultation. What is your website one more time?
Okay, we're NEOSkinCenter.com. And we're right in First and Main in Hudson, right off of 91 and 303.
Well, thank you so much for joining us today, Dr. Bedrick.
Thank you.